welcome, welcome, welcome. It's time for another episode of We the Doctors. My name is Dr. Jules. Today we are treating a topic that is found globally. We actually have 1% of the population having it, but we think it's about time we address it just to create the awareness. So that for a change, we are not talking about something that has gone overboard. Let us start from the grassroots so that we don't have issues. Of course, I have my panel of doctors here, Dr. Valeria, Dr. Yvonne, and Dr. Okay, my goodness, I have to give kudos to Kinabuti. She's really, I don't know. Yeah. I looked at myself and I was like, okay, is this me? Good. Good. Kudos to her. She's doing a fantastic job. Absolutely. Today, we're talking about eating disorders. Yeah. I know when people listen to the word eating disorder, you know, one thing that comes to mind, you see people that maybe they want to eat everything. You want to eat everything, that's one side. Another side is, oh, let me not eat too much, let me go and flow up. Exactly. We see that a lot in the movies. But to give it a proper definition, it's a psychological illness, actually. So it's not something that we should take lightly. Yeah. It's a psychological illness defined by abnormal eating habits that may involve either insufficient or excessive food intake to the detriment of the individual's physical and mental well-being. So we must treat it. And definitely, when you think of this, you'll be wondering, what is influencing all this? What are the factors responsible? I will go first. Okay. Westernization. True. Everybody wants to be the next top model. We now have Africa's next top model. So kudos to them. But I'm just saying it's an image thing. And there's a particular image that is going around and it's influencing, you know, our youngsters. Let me put it that way. Everybody wants to be, you know, a model. So that is part of the factor that is influencing this now. People don't want to eat right.
Do we now come to say that westernization is a cause? You know, there's nothing good in looking slim and pretty.
I know that's your spec.
Yeah, I mean, so if they decide to con with the standard,
but you can do it in a healthy way.
Yeah, you can do it in a healthy way, but you know, sometimes some people, their family history cannot help. That's the only way they can work it out.
The challenge is when we believe that modeling must be just for those slim people. That's what creates that problem.
No, there are full models now. They're big, bold, and beautiful.
Why don't we try to copy the full ones? Yes. And why must it be those skinny, what they call ones?
But you know, it's more of a subliminal thing. At the end of the day, they're not saying this is how you must be. This is how, you know, but
that's what they're pushing.
Society.
And some societies actually, they appreciate those people that are really very slim. They put them in a particular class. Exactly. You understand? Exactly. So that's why people too.
How many of those ones you are describing? When we do beauty pageants, how many times do we see, you know? So these are the issues. That's where Dr. Yvonne later on will be telling us about media influence. I'm sure she will chip that in.
And now media influence is very important to I know. Social media these days, Instagram, this one, you see somebody just wants to change her shape from what's it called, apple to pear. No, it doesn't happen. You understand? You see someone on TV, you idealize. Oh, straight away. You understand? You have to.
But you know the thing is, and they'll do the before and the after and all that. But you know, another thing is that you want to, you know, educate yourself. These things, we are saying this because there's a healthier way to do it. You don't want to now deprive yourself and do harmful things because we're saying it's going to result to health problems. But now, other things also.
When people already have a psychiatric condition. Or some mental conditions, there's a tendency to want to eat more or eat less to your own detriment. For example, when people are depressed, you find it both ways. Some begin to spend more time with food, eat and eat and eat. And then some don't even want to eat at all. In anxiety, some people want to just anything they find put in the mouth. And then often in children, when we talk of attention, hyperactivity disorder, we find them trying to eat more or don't even eat at all. They are too busy doing other things that they don't get to eat. Now, I won't say that in itself is an eating disorder, but it's a disorder of eating, however that sounds, that can attached to a psychiatric.
But then forget talking about we know that there's some medical issues or psychiatric issues that may be related to that. But I like to dwell more on the reality. And that's what we're talking about, our environmental causes. We're talking about peer pressure.
There you go.
A whole lot of that you know, if you find a girl that, you know, 3, 4 of our friends are slim and cheeky, and maybe people call them.
And for you to even be in that clique.
And then you're in that clique and you're like, you know, after a while, just before you know it, you realize they start starving themselves. These are people, sometimes they end up in the hospital. That's the sad part.
Even with ulcer.
With ulcer.
Yeah, exactly.
A lot of times, because you can't, you're trying to keep fit, you're trying to do this thing, you're starving yourself. Someone tell you, I want to lock my teeth, I want to block my, it's sad though, but anyway, but then again, we're not saying it's not good to look good.
Exactly.
I mean, we're not saying it's not good to desire what you want to be like. And then sometimes you put a picture of, I'm not sure if you've seen this image before, of someone that has, a lady on the big side, she's trying to keep slim, then she has a picture of what she wants to look like, and she put it there, and she has the treadmill, and on top of the treadmill, there's chicken and turkey and everything.
Oh yes, I've seen that image. It's very unrealistic.
Exactly.
But at the same time, I like the fact that we are pointing out these issues so that people can relate to it. We also have environmental issues. Sometimes some people might even relocate and stuff like that, and you might not be used to the food, and then you're subject to all sorts of things. But it's a good thing, like I keep saying, that we have specialists that will be coming on later in the show to shed more light on the topic. We are talking about eating disorder today. Let's take a quick break, and then we'll be right back.
Coming up next.
Illness that actually causes sort of disturbance in eating habits. Either the person doesn't eat at all or eats too much, and this actually takes a toll on both the physical and the mental well-being of this individual. Exactly. Hi, you're welcome back. It's We the Doctors. I'm here with my colleagues. We've been talking about eating disorders. I'm Dr. Yvonne, and in this segment, we'll be talking about the types of eating disorders. I'm sure you have a lot of them. You're naming them one by one, but you get to know as we go on. Earlier on, Dr. Jules said, she explained what eating disorders is. She said it's a physiological illness that actually causes sort of disturbance in eating habits. Either the person doesn't eat at all or eats too much, and this actually takes a toll on both the physical and the mental well-being of this individual. Exactly. These people here are too concerned about their weight. They are concerned about how they look, how people perceive them. They are too preoccupied with this kind of things. And people think it affects just females. Yes, most times females, but a growing concern now is pointing towards males too.
I know.
Don't think that they are not having these eating disorders.
Ever since the skinny jeans came in.
I don't know why she's pointing at me.
It's been a problem.
She's saying growing concern.
I beg to differ though.
Well, no, men too have eating disorders.
Not in our part of the world.
Okay, however, there are two types we are going to be talking about now: anorexia nervosa and bulimia nervosa. The first one is anorexia. Most people use this word every time. They just say, oh, you're anorexic. When they say someone thing, you're anorexic. What does it mean?
They just say, they're not eating well, you just say they're anorexic.
Immediately, do you understand? So
lightly.
these people that are actually anorexic, what happens with them is they are too concerned about their weight. They say they will say they are overweight even when they are underweight. BMI is below 17.5.
Exactly.
They are always going to the scale to check their weight. They are too particular about things like this. Do you understand? And particular about what they eat. Eat certain kinds of food and don't even eat it the way they ought to eat it. Exactly, they are too concerned. So there's so many symptoms. We'll still be talking about
extreme thinness. Like you said, it's not enough for you to say somebody is saying, oh, you're anorexic. It is actually clinically diagnosed. Let me put it that way. Dr. Yvonne was saying something about the BMI. You have to talk to your doctor about that. If it is less, it's usually between 18 and 25. If it is less than that, even lower, below 17.5, then you have a big problem. You see some people, their ribs, you can actually see their ribs showing.
And they're still complaining that they're overweight.
Now that's the
yeah, but I also think it would be nice for us to differentiate in the sense that some people might have extreme thinness, but doesn't necessarily mean they're anorexic. It may not be their own intent making to find themselves in that particular instance. So we're talking about someone who can do something about it, who intentionally keeps themselves extremely
It's different from when you're living life normally. But you
don't realize that based on lifestyle or conditions or whatever it is, that's why you're thin.
True.
So they don't just see anybody that's slim and skinny on the road and say, you are anorexic.
No,
in people that
have
anorexia, there's this extreme fear of adding weight.
Yes.
They don't want to. In fact, they think they're already overweight. That's what their mind tells them.
Right.
So they keep starving themselves because they're afraid that they will add some weight. So one other thing that is important is in people who are anorexia patients, there's this extreme fear of adding weight. They don't want to add weight at all. They're already underweight.
Yes,
I don't use the word slim because most of them are already below the normal BMI.
Exactly.
You get some of them at 15 as BMI that you even want to admit them in the hospital just for the fear of being overweight. So they eat very little or they don't even eat at all. When they come in, I say you are starving yourself and they don't even deny the fact that they're starving themselves. They will tell you that, yes, I am, but I still think I'm eating too much. That's why you find them in anorexia, extreme fear of adding weight. That's one thing.
Yeah, some of them also have what they call distorted body image. They look at themselves in the mirror and they feel like, look, I'm too big.
So
I don't like the way
they haven't gotten to where they want to be.
Do you understand? So they just keep, you know, like okay said earlier on, they keep starving themselves. They, you know, make sure they don't eat food when they're supposed to eat. They don't get enough rest. They do some habits to ensure that they keep to that particular image that they want to be like. You know, it's really, really sad.
And
but we
again,
hope that with time our people will get sensitized about those things and then get out of it.
Case of amenorrhea, that's they don't even see their periods for quite a
now,
while.
this is for ladies,
yes, for
ladies,
ladies.
not for me.
Yes, for ladies. It may even take up to as much as 6 months sometimes. No period.
But the thing you to point out there is that how do you expect your period to be normal? So you don't want to do that.
So again, then we'll talk about bulimia nervosa. Now this one is different. Here, these people have frequent episodes of what I would call binge eating. That's eating unusually large amounts of food. Here, they have no control at this point. Then it's usually followed by as in a period of compensation where I will say, okay, they maybe feel sober for eating that kind of amount of food, thinking that the weight is going to just go like that all of a sudden. Now they now start purging. When I say purging, I don't just mean they are going to the toilet to poo. There's they induce this sometimes by vomiting. They take laxatives to help them as in pass through.
So after eating a lot of things, you just go
and some people starve. Some people starve for a very, very long time. Some people starve for a very long time. And some people will also go to the extent of over-exercising. Yes, these are things that they actually do at this time. And these people that are bulimic most times are normal weight. They have a normal BMI and only a few times they are overweight. Anyways.
Which now emphasizes the definition. It's an eating disorder. You're not eating the right way. So you can imagine somebody always throwing up. The person will always have throat issues. It will be inflamed. Your gastric juices are acidic. It's going to burn your throat. They will be coming with complaints of sore throat or some kind of irritation in the throat. It's very, very sad.
And taking on that acidity, you know, when you bring stuff up from your stomach, that acidic, as you said. So imagine having to rinse your mouth often with some mild acid. Your teeth is going to begin to wear off. That outer layer is going to begin to wear off. And so you have them coming with complaints about their teeth.
And then it also talks about acid reflux. You're trying to throw up and all of that. A lot of times you start having issues with that. And then one of the things is that you may have electrolyte imbalance, you know, in situations like that, basically.
So, like
when you say electrolyte imbalance, it's like a big thing.
Well, it's something that they can identify in the lab, though.
Tiny chemicals that your body begin to...
That now balance up, exactly. And that's because you are either throwing up, you know,
too much
or you've lost a lot of, you know,
fluid from the body. And also there's severe dehydration owing to the throwing up so much or use of diuretics that cause them to pee so much. Anyway, these and many more, however. But let's go to the streets and hear what people have to say about this topic at hand, and we'll be right back.
I wonder what people will say about it.
I wonder.
We'll be right back.
Hello and welcome back. The show continues. It's We the Doctors. It's time for our interview segment. We have a psychiatrist in the studio with us. He's no newcomer to our panel. We have Dr. Adebayo Ayomide. Dun, 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 dun.
Welcome.
Oh, welcome. You look dapper in red.
Yes.
Thank you.
So we're talking about eating disorders today. And we've established that it's a psychological problem. It's an abnormal eating habit. How can people recognize it? Fine, they know that we are talking as medical professionals. We can pinpoint certain things. As a loved one, you're living with someone that's having the problem. There's one thing to say somebody looks trendy, oh, you are hot. So another thing to say, oh my goodness, there could be a there could be a problem here. So how can, you help our viewers make that distinction to say, oh, this person needs help?
Okay, well, typically when you say psychiatric disorders, it actually is mental and behavioral disorders. eating disorders, like sleeping and sexual disorders, basically, if you notice, those are like the disorders that have to do with the main appetites.
Okay.
They are mainly behavioral disorders. And so the first thing that you want to keep in mind is it's not how the person looks, it's what the person is doing.
Yes, because we've been talking about...
It's being a disorder. It's not whether the person is thin or not thin.
Yeah. Okay.
It's, although that would usually be the result, but it's not that. It's how the person got to that point. Or what the person is doing to stay there.
Sorry, I want to add to that because we've been talking about the other characteristics like when the person is inducing themselves or taking laxative.
Yes.
I would imagine these things are done in secret.
Typically, yes.
Yes, so how...
How do you know? You would know because of other things.
Okay.
For instance, especially because if you live with the person,
yes,
there'll be some signs. The fact that maybe you never see the person really eating anything, you know, especially for anorexia. Yes. The difference between anorexia and bulimia majorly is that in bulimia, they tend to gorge and then purge. So there's that, you know, gorging and purging cycle. Unlike in anorexia, where the person doesn't ever gorge.
Yeah. Right.
You know, sometimes you think of anorexia as people who have like the self-will that, you know, people that have bulimia don't really have, you know. So, but bingeally, there's that. So for someone that has anorexia, for instance, you see that they probably never eat. They exercise a lot, you know. So because they do it in one of two ways: either they reduce their intake significantly or increase their output significantly, or both. Right. But in both cases, excessive.
Exactly.
So you see that, and then the person tends to have a preoccupation with, I don't want to be fat. They tend to overreact to, you know, anything and even and more importantly, because you know you see people who have that kind of preoccupation, and it's not that they're anorexic, but more importantly, even when they're thin, they still see themselves as fat. So there's that body image perception that is not doesn't quite fit with, you know, and then so it's those kind of things that may make you begin to think, okay, is this normal?
It doesn't really add up.
Is there something wrong here? Yes. And then you may want to now consider going to see a doctor.
Okay.
I want to know, now we've explained, I think this is anorexia. People are watching this show and tomorrow they're going to think someone in their home
might.
Yes, and so that's the thing I'm really careful to.
Yeah.
It's not about, I would say that again, it's not about the person being slim or slender.
Because somebody can be that way naturally.
Exactly.
A lot of people are like that naturally. I was like that for years.
I know, I should know.
You know, so it's not about that. It's really about the mindset and then the behavior that results from that mindset. And the mindset is there's something wrong with the way I look that I need to do something about. Even when other people say, the truth is that sometimes the person was overweight and that's where it started. Right. But sometimes the person is already slim and the person is still seeing themselves as being overweight or being too fat and things like that. And then there's now the behavior that results from that mindset, which is the excessive purging, excessive exercise, excessive starvation, you know, and beyond what people around them feel, especially close people who care about these people, or, you know. So even if you are the person and you realize that people around you have been mentioning this, and then you also have noticed that you tend to think a lot. In fact, the major key is the person defines themselves by how they appear. To an extent that defines almost everything else.
Really?
Now, this question is a dicey one. You have someone who is obese and overweight, and the person decides, I have to get in shape. I have to get between 18 and 24 as my BMI, normal BMI. How often do we get those people tipping over to anorexia?
Well, that's I can't give you a figure for that. But I think what's interesting to me is drawing the line again between it's okay to want to get in shape, it's okay to want to be healthy, it's okay to say you want to lose weight, you want to exercise more. All of that is fine. All right. It's not okay to define yourself by that. And then to the point where you go beyond even losing weight to hurting yourself, to harming yourself. I mean, people get so starved that even, I mean, when someone that has anorexia has to be admitted to feed, there's even a way you have to feed, because if you overfeed, you know, you can shut the person's system down, and that's it. So, I mean, that's how bad the person may have starved themselves. So it's, I mean, when it's again, it's that mindset, defining yourself by that, and then carrying out activities to reduce your weight or to prevent weight gain to a point where you're actually harming yourself.
Right. So how common is this in our environment, this eating disorder?
It's generally it's been found to be as common as everywhere else, and westernization is obviously part of that. Social media is here. The US is no longer,
far away.
Before when it takes 2 years for stuff there to get here. Now it's happening in
the US is on your
immediately.
So we're looking at about between 0.5 to 1%. That's between 5 to 10 in every 1,000 people.
Okay. So that's a significant amount of people. So thank you so much for joining us today. It's always delightful to have you. So like we've said, eating disorder is something that you should consider seriously. Most of the time, you need a specialist to help you. And in this case, a psychiatrist. So don't be afraid to seek for one or guide somebody towards the right help. So stick around. We'll be giving you more tips on how to help yourself. If you feel that you're having this issue or you feel you need to see a specialist, we're talking about the tips on how to help yourself before you get there, if you do get there. So stick around. We'll be right back.
Hello and you're welcome back. If you're just joining us, this is We the Doctors. We have been talking about eating disorder. A big thank you to Dr. Ayo for coming around, shedding more light on this issue, basically. But on this segment, as usual, we're going to be talking about ways to prevent eating disorder. So Yvonne, you can go first.
The first one I'll be talking about is listening to your body. Eat when you're hungry. That's what I'm about to say. Eat when you're hungry and stop when you're satisfied. What I would like to call body talk. Yes.
What if my body's not even talking to me at all again?
You know what?
I've tamed my body in such a way that it doesn't speak. So I'm never hungry.
See, and there's also a research that says that it takes about 20 minutes before your body will tell you that you are full. So don't wait. Sometimes you might want to be patient. That's not what I said, though. You might want to be patient.
You should eat it for 20 minutes.
No. But what I'm saying is that at least you should work with portions, because sometimes some people, they will just be like, oh, let me just keep eating. So sometimes if you feel as if, okay, you should put, that's why we are talking about these things. You should be cautious. If you have to do swallow, it should be your fist size, or your what they call it, your wheat, your eba.
Yes. Do I have a medical condition?
Oh my God. That's the size of the swallow that you should put on your plate. And then we talked about purging. Let me remind you, most times we talk about purging, we are talking about laxative and all this stuff. People take herbal concoction to purge. And they do it on a steady basis. I've been waiting
for this purging.
Yes, because I had a patient that came in and she was like, oh, I am purging and stuff. And I thought it was a symptom. It was actually induced. It was Dr. Yvonne that even pointed it out to me that she induced it. So I was like,
she was coming to stop it.
She was coming to stop the purging.
So
that she has induced.
So you now realize that was embarrassing.
Please don't do it, because we are saying these things because we try to. It kind of flies over our heads. I'm sure you know a couple of people like, oh, let me go and purge. You know, you can easily taper into this problem that we're talking about. So please keep your eyes open and seek help when necessary.
Additionally, your nutrition has to be adequate.
True.
It's not enough to just say, listen to your body, don't eat too much or don't eat. No, your nutrition has to be adequate. Basically, in schools, we learnt it, and if you haven't learnt it, we have carbohydrates, food like your normal rice, you have protein, your fish, you have fruits, you have vegetables, you have lots of things. Yes, get your meal to be balanced and eat properly. It's necessarily not about how big you are or what you think your body is. If you eat properly, you fall into the normal BMI that we expect, and you have everything you need for a balanced health.
All right, finally, before we go, there's one other point. This one is not even about food now. There's some people who eat normal diets, but what they do is that they burn it out. They can exercise from now to Babylon.
I know.
And we tell them to take it easy before you become transparent. There are some things that are, it's okay, but when it becomes going up, abnormal, then it becomes an issue. Yeah, you find some people telling you that they want to do the exercise excessively and all of that. So just be easy.